Bismillahir Rahmanir Rahim. This is your second lecture, and it's about general examination and abdominal examination. I will start with general examination. I will give you the just brief point about general examination, and then after that I will give you details of the abdomen examination. In general examination, you determine the following: the level of consciousness, whether the patient is conscious or not; mood, cooperative, the patient is cooperative or not cooperative; is the patient irritable, is he nervous, is she nervous; does the patient look not ill or very ill. And sometimes the patient comes to hospital, that means he's ill, but sometimes he doesn't look ill because the disease doesn't make the patient look ill. So you just comment on that, whether the patient looks ill or not. You look to the conjunctiva so that you can see whether there is yellow discoloration of the conjunctiva also, and this denotes jaundice. Jaundice, you can see it in fair-skinned people. You can see the jaundice in the skin, but in dark-skinned people you cannot see the jaundice in the skin. So that you look to the conjunctiva to see whether they are yellow or not, to determine whether the patient is jaundiced or not. You look to the lower lids. You just hold the lid downwards and see whether the lid is pale or pink. If the lid is pale, this denotes that the patient have anemia. You look to the mouth and tongue and determine whether it is dry or moist. Dry mouth is in dehydration or some other diseases. You hold the pulse, and from the pulse you determine the rate, the rhythm, the volume, and whether it is regular or regular. You determine these things. They are very important in all types of diseases. And you measure the temperature and you measure the blood pressure. These things are very important in general examination because they are part of the well health of the patient. Now we come to the specific examination of the abdomen. You will start the examination of the abdomen by inspection. So you just look to the abdomen and comment on what we see. One of the things that you have to comment on is the contour of the abdomen. Contour of the abdomen. Look to this first picture, and you can see this is a ruler. This is a ruler. You put it is on the abdomen, and then you can see that the abdomen is convex downwards. The abdomen is convex downwards. And this is called scaphoid abdomen. It's called scaphoid abdomen. And this is some sort of normal abdomen. When the patient is slim, thin, you can see this type of abdomen. And now you can look to this abdomen here downwards, and you can see that almost the abdomen goes with the ruler, flat. And this is flat abdomen. The ruler almost touch the whole abdomen, and the abdomen is flat. And this is also sometimes some kind of normal contour of the abdomen. You look to this and you can see the ruler here. You can see the abdomen is convex. The ruler is touching here only in this point. The ruler is touching here, and in these points the ruler does not touch here or here. The ruler does not touch the abdomen because the abdomen is convex outwards, and this is distended abdomen. This distended abdomen, it can be due to obesity, the patient is obese, or due to something inside the abdomen, ascites or gas distended coils of intestine in the abdomen. You will determine this by looking to the umbilicus. In this photograph, you cannot see the umbilicus because the umbilicus, the picture is from the side, and you cannot see the umbilicus. So that you cannot say whether the umbilicus is normal or not. The normal umbilicus is inverted umbilicus. It has going inside. If you look to these two pictures, you can see that both of these abdomen are distended. Both of these abdomens are distended. if you look to the left picture, you can see the umbilicus and you can see that it is normal. It is an inverted umbilicus. It is normal. And if you try to make the picture more, you see, you can see striae. You can see striae. These small things, striae. This previously they are called striae gravidarum. They are called striae gravidarum. And this is striae and the normal umbilicus and the full flanks. Usually this is obese patient. This is obese patient. And in the obese patient, the umbilical is normal. Look to this picture on the right side. Also, you'll try to bring it larger. On the right side, and you can see the abdomen is descending and the umbilicus is everted. It's convex outwards, is everted. That means it is pushed by something from inside. It is pushed by something from inside. This is a fair-skinned person. If you look to the skin, you see that the skin is yellow. And yellow skin will tell us that the patient is jaundice. And we know that jaundice is produced by disease of the liver.